Angelman syndrome is a genetic disorder. Look at this picture shows that neurological defects, gene, chromosomes, detail going on. Introduction. Angelman syndrome is a rare neurological disorder characterized by severe developmental delays, intellectual disabilities, speech impairment, and a happy demeanor with frequent laughter. Named after Dr. Harry Angelman, who first described the condition in 1965. This syndrome is often misdiagnosed as other conditions like autism or cerebral palsy due to its overlapping features. Definition: Angelman syndrome is a genetic disorder primarily affecting the nervous system. It is caused by the loss of function of the UBE3A gene on chromosome 15. This gene is crucial for normal neurological development, and its absence or malfunction leads to the symptoms associated with the syndrome. Type Type 3. Angelman syndrome can be categorized based on genetic mechanism causing the disorder. 1. Deletion positive AS. The most common type occurring when the maternal copy of the UBE3A gene is deleted. 2. UBE3A mutation caused by mutations in the maternal UBE3A gene. 3. Uniparental disomy occur when a child inherits 2 copies of chromosome 15 from the father and none from the mother. 4. Imprinting defects ID involves errors in the imprinting process that controls gene expression. 5. Unknown mechanisms. In some cases, the cause of Angelman syndrome is unidentified. Causes. Angelman syndrome is primarily caused by genetic mutations or deletion on the maternal chromosome 15, specifically affecting the UBE3A gene. The UBE3A gene is expressed from the maternal chromosome in the brain, and its loss leads to the neurological symptoms seen in Angelman syndrome. The specific causes include 1. Deletion of the UBE3A gene on the maternal chromosome 15. 2. Mutation in the UBE3A gene. 3. Paternal uniparental disomy UPD. 4. Imprinting defects. Risk factors. The main risk factors for Angelman syndrome is having a family history of the disorder, especially in cases involving genetic mutations or imprinting defects. However, most causes occur sporadically without a known family history. Complications. Individuals with Angelman syndromes can face various complications including 1. Severe intellectual disability, 2. Speech impairment, often non-verbal or limited speech, 2. Epilepsy, 3. Sleep disturbances, 4. Motor difficulties, example ataxia, poor coordination, 5. Behavioral challenges, hyperactivity, short attention span, 6. Feeding problems due to swallowing difficulties. Pathophysiology. The pathophysiology of Angelman syndrome is linked to the loss of function of the UBE3A gene, which encodes for an enzyme involved in protein degradation within neurons. The absence or malfunction of this enzyme disturbs normal brain functions, leading to the neurological and developmental issues observed in the syndrome. The UBE3A gene is only active on the maternal chromosome in certain brain regions. So, a loss of maternal UBE3A expression results in this syndrome. First, gene imprinting and UBE3A function. 2. Genetic abnormality including loss of maternal UBE3A function. Then types of genetic abnormalities, imprinting defects. 3. Loss of UBE3A enzyme activity, neurological impacts. The neurological consequences: synaptic dysfunction, altered brain development. 5. Clinical manifestations, behavioral phenotypes, the loss of UBE3A function, epilepsy. 6. Long-term impact, ongoing neurological challenges. Signs and symptoms. The signs and symptoms of Angelman syndrome typically become noticeable in the infancy and early childhood, including 1. Delayed developmental milestones, sitting, crawling, walking. 2. Severe speech impairment. 3. Happy demeanor. 4. Movement disorders. 5. Microcephaly. 6. Seizures. 7. Hyperactivity and short attention span. 8. Unusual behaviors. Diagnosis. The diagnosis of Angelman syndrome involves 1. Clinical evaluation based on the characteristic signs and symptoms. 2. Genetic testing. Conformity testing include 3. Methylation analysis to detect imprinting defects and deletions. 4. Fluorescence in site hybridization to identify detection on chromosome 15. 5. UBE 3A gene sequencing to detect mutations. 6. Chromosomal microarray to identify UPD and other genetic abnormalities. Nursing diagnosis. Some nursing diagnoses associated with Angelman syndrome include 1. Impaired verbal communication related to speech impairment. 2. Risk for injury related to seizures and motor incoordination. 3. Sleep pattern disturbance related to sleep disorders. 4. Risk for imbalanced nutrition related to feeding difficulties. 5. Delayed growth and development related to intellectual disability. Management. Management of Angelman syndrome is multidisciplinary and focuses on symptomatic treatment and supportive care. Key components include 1. Seizures management. Anti-epileptic drugs to control seizures. 2. Physical therapy to improve motor skills and coordination. 3. Speech therapy. Alternative communication methods such as signs, language, or communication devices. 4. Occupational therapy to enhance delayed living skills. 5. Behavioral therapy to address hyperactivity and other behavioral issues. 6. Sleep management strategies and medications to improve sleep patterns. Treatment. There is no cure for Angelman syndrome, but treatment focuses on managing symptoms. 1. Anticonvulsants for seizures control. 2. Melatonin for sleep disturbances. 3. Adaptive devices to assist with mobility and communication. 4. Regular monitoring for developmental progress and complications. Psychosocial medicine. The psychosocial aspect of Angelman syndromes are crucial as the conditions can significantly impact on quality of life, both the affected individual and their family. Psychosocial interventions may include 1. Family counseling to provide emotional support and coping strategies. 2. Support groups for families to connect with others facing similar challenges. 3. Educational support, tailored educational programs for children with Angelman syndrome. Prevention. Since Angelman syndrome is primarily a genetic disorder, there is no known way to prevent it. However, genetic counseling is recommended for families with a history of the syndrome to understand the risk and make informed reproductive choices. In conclusion, Angelman syndrome is a complex genetic disorder with profound effects on the nervous system, leading to a range of developmental and neurological challenges. While there is no cure, early diagnosis and multidisciplinary approach to management can help improve the quality of life for individuals with syndrome and their families. Ongoing research into gene therapy and other interventions offer hope for future treatment options. Thank you. Have a good day.